Well, welcome back, everyone. We are here with Dr. Rhonda Medina from Lima Memorial Health System, OBGYN, here to talk to us about Cervical Cancer Awareness Month and what should be kept in mind when it comes to preventative care against the disease. So, firstly, can you tell us a little bit more about what cervical cancer is and also who it affects?
So cervical cancer is a cancer of the cervix, which is the opening of your uterus. And it is something that affects mostly 35 to 45-year-old women, but it can affect anyone of any age. And it is one of the most preventable cancers. So early detection and prevention are the most important things about it.
Right. So you mentioned early detection. Like, what symptoms should women be aware of with cervical cancer?
So unfortunately, cervical cancer usually has no symptoms until it's advanced. And some of those symptoms are abnormal uterine bleeding, bleeding after intercourse, an abnormal vaginal discharge. But those can be caused from so many other things as well. So it's important to have your yearly exam to help prevent things.
Yeah, definitely. So how can someone take charge of their health and prevent or maybe detect cervical cancer early?
So the most important thing to know about cervical cancer is that 90% of them are related to an HPV virus. Now, HPV is a virus. There's hundreds of different types of HPV viruses, but there's 4 certain ones that are high risk to cause cervical cancer. So the best thing to know about it is to help prevent from being exposed to it. Exposure to HPV viruses, early sexual activity, not using condoms, multiple sexual partners, and just preventing getting the virus itself.
Right.
There are certain other risk factors. It's been linked to like long-term oral contraceptive use, but it's more because I think people that are on birth control pills don't use condoms as much, and so they're increased risk of exposure to the HPV virus.
Right. So can you maybe walk us through what a patient can expect when maybe they receive a pap smear or maybe an HPV test?
So a pap smear is traditionally what we have used to detect cervical cancer. There's been a lot of technology and innovation with the HPV virus itself. So if you start your pap smears at age 21. It used to be earlier than that, but now it's age 21. And if the pap smear is abnormal, then we do an HPV typing. If you're over 30 years old, we do an HPV typing automatically with your pap smear.
Okay, so if someone has questions about cervical cancer or maybe just would like to schedule a annual wellness woman appointment with you, how can they contact you?
The number should be on the screen. You can call, and we're accepting new patients, and we're located right beside the Lima Memorial Hospital.
All right. Well, Dr. Medina, thank you so much for coming on today. I appreciate it.
No problem.
All right. Don't go away because we have more when we return.